Hello, today let's talk things concerning health. I want to talk about a condition known as diabetes mellitus, and I want to say that there are various types of this condition. But first, what is it? It is the high levels of sugars in someone's blood, and this one is confirmed via some tests. There is what we call random blood sugar. Your blood sugar is taken when you have fainted, and there is what we call fasting blood sugar. And in this test, you are tested without taking anything overnight. That means you will have fasted. There is what we call gestation diabetes or DM, and this one commonly overtakes the pregnant mothers. It comes to due to pregnancy. There, again, let me say, apart from doing random blood sugar and fasting blood sugar, there is another test which we do called HbA1c, and this one is to test the amount of sugars. How have your sugars been for the past 3 months? And this really is what confirms and to us if really you are diabetic or not. What are the signs of diabetes? The signs of diabetes, you may present with polyuria. This is excessive urination. You feel you to pee every time you want to visit the toilet. There is also excessive thirst. You feel thirsty. You have to take a lot of affluence. You can have fatigue. You can have blood vision. You can have dizziness. You can have generalized body malaise or body weakness. And sometimes when it complicates, you may even present with convulsions. How does it happen, or what is the pathophysiology of it? There is an hormone called insulin, which is produced by the pancreas. And this insulin is the one which helps in the utilization of the sugars or of the carbohydrates you take or of the glucose you take. Once you take the food containing once you take in the carbohydrate, which is the glucose, the insulin is the one which helps this glucose to be converted in such a way that it can be used by the cells to produce energy. But now, for example, in type 1 diabetes, there is either you may be producing very little insulin, or there is no production of insulin at all. And this happens when the cells of your pancreas have been affected or have been destroyed by your immune system. This one is commonly an autoimmune disease, whereby the cells of your pancreas, which are responsible for producing insulin, they are destroyed mistakenly. And as a result, there is no insulin at all, or it is being produced in a very little amount. And it commonly occurs in juvenile or in children or young age. And these patients mostly they have to depend on insulin the whole of their lives. There is this other type 2 diabetes, sorry. In type 2 diabetes, there is either enough insulin, but it is not being utilized well, or the cells of the body are not able to utilize the insulin in the conversion of the glucose. That's how it comes about. What are the complications of high blood sugars? One of the complications is retinopathy, or what we call your eyes are affected. And this one I know is a topic for another day. We shall discuss it. Even as the time goes on, we shall discuss it another day, people. And there is also what we call neuropathy. Neuropathy, your nerves are affected. Remember, these high blood sugars, they also affect the microvessels of your peripheral system, of your lower and upper limbs. And there is no enough blood supply in this case. As a result, your nerves are affected, and in this you may present with, you either feel numbness on the feet or on the hands, you either feel pricky sensation. When you have a very small wound, it fails to heal. It becomes very difficult for it to heal. And also you have this burning sensation on the feet. There is what we call also nephropathy. High blood sugars also affect kidneys. That is why every time you feel that you have symptoms, you are supposed to go and be tested. And even if you don't have symptoms, sometimes it is good to do what we call health checkup. You go and be checked in the hospital. And then if you have been confirmed to be diabetic, that is not a death sentence. You can live with it, but control it. Make sure you comply to your medications so that you can have controlled blood sugars to prevent the complications. And also, you do monitoring blood sugar level monitoring every time. It's good to be tested to know how are your sugars. If they are lowering or if they are becoming more high or they are being maintained at normal diet, at normal reduce, sorry. And then there is this issue of diet. If you have been confirmed to be a diabetic or pre-diabetic, it's good to regulate your diet in such a way that you are not taking a lot of glucose. Take just a very little amount. And with that, let's have a take-home message that it's always good to make sure that your body is in the right condition. Go do the checkup. If you haven't been checked, you haven't been confirmed, comply to the medications, and you will be well. Bye. We shall talk about the other conditions later.